Hello, I'm Dr. Krithishree. I've completed my MD in Psychiatry and currently I'm working as consultant psychiatrist in KMC Hospital Mangalore. So substance addiction, in this there is involvement of a psychoactive substance like alcohol, nicotine or any addiction drugs, illicit drugs or even prescription medications. So here what happens, a person uses it compulsively and repetitively to an extent that over that period of time he develops physiological and psychological dependence on it, and there will also be withdrawal symptoms associated with it. However, coming to behavioral addiction, here also like the person shows compulsive behavior towards certain rewarding activities like gambling or gaming, internet use, sex, shopping or even eating. Whereas here the psychoactive substance use is not involved. However, though there is no substance or that is psychoactive substance use, it shows a similar pattern like what happens in substance addiction, where these people with behavioral addiction, they show loss of control, craving or even continued behavior despite negative consequences. Also, even though there is a significant social, occupational or academic decline, people will continue to use these substances or continue to get engaged in this behavior. Yes, in both substance addiction as well as behavioral addiction, the release of dopamine is involved in the reward pathway, and it is not the same extent like what happens in both sides. In substance addiction, the psychoactive substances directly and intensely stimulate the dopamine pathway, leading to increased craving, tolerance, loss of control, and even blunted response to natural rewards. Even physical withdrawal symptoms are seen in them. However, in behavioral addiction, the dopamine surges happen intermittently. So the positive reinforcement what they get during the behavior, it is lesser compared to substance addiction. Yes, psychotherapy can have a role in management of these behavioral addictions. They focus on the triggers and the thought patterns. Psychotherapeutic techniques like CBT, that is cognitive behavioral therapy, focus at the distorted thoughts driven by the impulses. And other therapeutic techniques like habit reversal technique, HRT, it focuses on positive coping skills. Similarly, dialectical behavioral therapy, DBT, it focuses on emotional regulation. Then mindfulness exercises, this focuses on maintaining the urges. Yes, self-help tools helps in managing the behavioral addictions to moderate intensity. These tools help in curbing the impulsivity as well as it reduces by promoting positive habits in them. Tools like screen time tracking helps in fostering self-regulation. App blockers enforces limits on distracting apps. Digital detox poses intentional breaks from devices, hence reducing dependency. In case of gaming, patients also have shown severe malnutrition, unable to work under supervision, also isolation. And not the least, sometimes behavioral addiction can lead a person up to even self-harm behaviors, suicidal ideations and all. In such cases, we have to consider inpatient cares to such patients.